A study from the University of Hawaii at Hilo shows that suicide rates among veterans have surged in the past 15 years.
While there are many suicide prevention programs available, the study notes the underlying cause of those deaths could be different than what behavioral health counselors expect. UH Department of History officials last month published the piece, a historical comparison of U.S. Army and U.S. civilian suicide rates from 1900 to 2020. They say the data shows many suicides among veterans are not necessarily tied to combat and PTSD. According to the article, the biggest mistake organizations are doing now is only looking at 25 years worth of data.
It does create this narrative that combat is directly related to suicide, even though historically, that's not always the case, or at least it's not statistically evident.
When looking at rates during World War I and II, suicide rates were the lowest, 5 for every 100,000 soldiers. The researchers believe societal factors, not war, drive higher suicide rates among men, both veterans and civilians.
Perhaps far too often, we're looking at things based off of narrow demographics, whether you're a service member or not, civilian or not, that there are factors here that are basically affecting everyone. And then in that sense that we're kind of in this all together here.
The researchers believe the best way to analyze suicide data among active military men is to compare them to civilian men. Both show similarities in trends, even as active members of the military are seeing more drastic changes. Researchers hope healthcare providers can adjust their treatment based on this latest information.
We should look for factors that are larger and probably more macro in this sense than combat when looking for the increase in the current suicide rates.